Well, hello everyone and welcome to today's webinar. This is an introduction to Montana Harvest of the Month for healthcare institutions. Today's webinar is being funded in part by a Montana Department of Agriculture Specialty Crop Block Grant, and we're very grateful for their partnership and support. My name is Demetrius Fassis. I am the Montana Local Foods Program Specialist at the National Center for Appropriate Technology, which is more commonly known as NCAT. NCAT is a nationwide nonprofit organization with 6 regional headquarters across the country, and we work on issues pertaining to sustainable agriculture and renewable energy. Developed by NCAT, the Farm to Cafeteria Network is a group of Montana food producers, processors, food service professionals, and community members that collaborate to share best practices and resources about farm to cafeteria programs across the state. And the Farm to Cafeteria Network's mission is to support vibrant local communities by increasing the amount of healthy, locally grown food served in our public and private institutions. So during this webinar, we'll go over what Harvest of the Month is and how it works in healthcare settings, how to get registered, and other resources that can be of help. As you're listening to today's webinar, you can type any questions that you might have in the chat box that you see on your screen, and I'll answer as many as we have time for at the end of the presentation. We might not be able to get to all of the questions during the webinar, but I will get back to you via email in days to come if that's the case. All participants are going to be muted for until the end of the webinar, and then I can allow some discussion at the end and unmute folks that are connected. So let's dive in. The Montana Harvest of the Month program showcases Montana grown foods in Montana communities with 2 main goals: exposing children and adults to new healthy foods and supporting Montana farmers and ranchers. By showcasing a different food each month, it provides an attractive and easy to use framework to start or grow farm to cafeteria programs and provides ideas, resources, and materials. The program is a great way to provide nutrition education, promote healthy meals, and to grow a team for supporting wellness initiatives within your institution and community. It is a collaborative statewide program, and it's been made possible by a myriad of awesome partners and funders. I mentioned farm to cafeteria and farm to school. Originally, this program was developed as a way to start or grow farm to school programs. Farm to school enriches the connection that communities have with fresh and healthy food and with local food producers by changing purchasing and education practices at schools and preschools with these 3 core elements that you see here. I want to give just a quick background of that. Procurement is obviously local foods that are being purchased, promoted, and served in the cafeteria or in snacks. Education is students participating in educational activities related to agriculture, food, health, or nutrition. And then school gardens obviously engage students in hands-on learning through gardening. Also, the definition of local in farm to school programs and farm to cafeteria programs as well is decided by the institution or the community. For the purposes of the Montana Harvest of the Month program, we define local as within the state lines, but some folks, Kalispell Regional Medical Center, for example, he actually has a radius out from their center that he calls local, so that includes some of Idaho as well. So before I get too far down the road, I want to talk about why you would take the extra time to do this program. This slide shows some of the benefits that Montana Harvest of the Month provides. The program grows collaborations and connections with community organizations and individuals. And further, it increases opportunities for local producers and businesses. It increases the economic strength in communities. And perhaps most important, it promotes Montanans' health and encourages adventurous eaters by improving people's attitudes and knowledge of foods that are grown right here in our state. The data from our pilot did indicate that people improved their attitude towards Harvest of the Month foods, while non-Harvest of the Month foods on the survey didn't show a significant increase. It is working. While Aubrey Roth and Montana Team Nutrition have been hard at work with the Harvest of the Month program in K through 12 schools, over the past couple years here at NCAT, we've been piloting Harvest of the Month in a handful of healthcare institutions and preschools with incredible results. These pilot sites have increased their local food purchasing, they've built strong teams to support their program, and they've provided meaningful education to people that helps them make healthier choices. They also serve foods which were new to the cafeteria, like winter squash and beets and lentils. They were able to try new recipes for old favorites like beef and apples. Currently, we're expanding to still more food service environments with a pilot that'll include grocery stores, restaurants, and food pantries. This map is part of the Farm to Cafeteria Network database and shows institutions that are interested. Well, there's an iteration of the map shows institutions that are interested or are actively growing farm to cafeteria programs. This iteration of the map shows all of the registered Harvest of the Month sites. We currently have over 130 schools and after-school programs that are registered for the program, and I think 18 early care and education, that's preschool sites, and 7 healthcare sites. Sites can register at any time of the year at no charge. And I encourage you, I'll show you where to find this map later, but I encourage you to reach out to other Harvest of the Month sites to discuss ideas or challenges, find ways to make collaborative purchases from producers or get network with other producers, or just to give each other kudos. You can find this on the NCAT Farm to Cafeteria Network webpage, which I'll show you later. So let's look at how it works. Each month features a different Montana grown or raised food. The calendar makes it easier to find local foods and to secure future orders, especially those winter storage crops. While we prefer that you follow this calendar so that all programs are featuring the same items at the same time each month, you're welcome to change the order of the calendar to suit your needs. None of the materials that we've produced are marked with the month. And over time, we're adding new items and changing the calendar so that folks can continue featuring new foods. And for anybody on the call that participated in the pilot last year, you can see we're adding 2 new items this year, dairy and chickpeas. So for the first time, we'll have a full 12-month calendar. And it's really important to utilize this calendar to reach out to producers in advance. I can't stress enough the importance of planning out the growing season with local producers. Some of the independent distributors that help source these Montana grown foods are well aware of this calendar and are already working with producers to make sure that that these items are available in the months in which they're assigned. So our team is here to help you. We provide the following to registered sites at no charge. That's mailing or providing 1 printed packet of materials, giving electronic versions of all the materials, in addition to more guides and other helpful resources. We do trainings like this, both in person and online, and of course are always available to answer questions. A few things that we don't provide. While we have this framework and a plethora of materials that support the program, we do not provide the food that you need for meals, snacks, tastings, or activities. Sites have to locate vendors that work for them, and we don't specify who you need to order from. Our team's happy to help connect Harvest of the Month sites with vendors and producers, but we're not trying to tell you who you should be buying from. We only ask that those items be purchased from within the state so that we're supporting Montana farmers and ranchers through this initiative. And we also don't provide a person to do educational activities in the institution. So all of the healthcare sites that are participating in Harvest of the Month have 4 main responsibilities as shown here. And I will go through each in more detail and show you some of the examples from the school sites, the healthcare pilot sites, and from the past 3 years of Harvest of the Month. So each site has a team lead who will receive all of the communications, and that person's responsible for completing the evaluation. Having a team in place allows you to spread out the work so it's not overwhelming for one person. It also allows you to make connections throughout your program to maximize the impact of Harvest of the Month. And sometimes this team might be part of an existing wellness committee that's in your community or in your institution. It never hurts to get creative with the team. At a minimum, that Harvest of the Month team has an administrator, some food service staff, and a dietitian. In this example, the food service manager, the dietary director is the team lead, but that can be anyone from the team. We encourage you bringing in others to serve on the team and help implement the program. And that could include producers, it could be clinical staff, it could be non-government organizations that are in the community, other community organizations, extension agents, really anyone that supports that is interested in supporting and promoting a health initiative. Anyone that's listed as a team member will receive monthly communications about Harvest of the Month. And if you need to add any new members to your team, please email me their name, their title, and their email address. And as far as monthly communications go, I send one email a month unless I need to do more for reporting reminders. Each site should serve the Harvest of the Month item in a meal or an a la carte option at least once during the designated month. The Harvest of the Month item could be an ingredient in a dish, like the beef in this chili. It could be offered on a salad bar or as a side option, like the greens or the carrots in the salad. It could be served raw, like the apples, or served in an a la carte option. And we do provide cooking tips and food service recipes in the handouts, but you're not required to use only those recipes. If you find a recipe that you love, share a picture, share the recipe with us so that we can get a good collection of recipes and photos. We're working on an online form through the Harvest of the Month portal that'll allow you to easily submit new recipes. We learned that that is something that sites desire through the pilot. And at any time as you're participating in this, feel free to make suggestions. We're always trying to adapt and change this project. So I want to give you a few quick recommendations on featuring Harvest of the Month foods and meals. Be sure to showcase the foods on the menu and at the point of service. We provide menu templates, table tents, illustrations, and logos, and signage that can help you garner that attention. Sampling a new item before it's served also helps to reduce waste and increase the interest. One tip that came from the pilot is serving an unfamiliar food item progressively throughout the month. For example, one site served beet brownies during February, which was beet month last year. They served beet brownies first, and anybody can get behind brownies. And next they served a salad with shredded beets, and then they roasted beets and served the beets on their own. And so it gave this kind of progressive introduction to a food that some people have a strong aversion to. So each month, participating sites have to conduct at least one educational or promotional activity. That could be as simple as putting the Harvest of the Month monthly announcement in the newsletter or on the facility's website or social media sites. Other ideas from the pilot include inviting staff, patients, or visitors to the monthly Harvest of the Month meal, sending that Harvest at Home handout, which I'll show you later, home with staff or patients, or harvesting or hosting a Harvest of the Month event during the year. And you could do that in partnership with another Harvest of the Month site in your area, or you could do that as an individual site. Taste tests are also an awesome way to do this, and they can be conducted during the mealtime, or it can be a separate promotional activity. It can even be a snack for staff in a break room. Taste tests help decrease waste in the cafeteria, and they are also a good way to help develop new recipes. A taste test guide will soon be added to the online portal, and I'm hoping that'll be helpful for setting up your taste tests. This example is a dietetics intern from Livingston Healthcare, and they had this kind of a table set up every month for one day to do those taste tests and help promote the Harvest of the Month. There are a lot of different ways to conduct taste tests. You can use voting cups shown here. You could have a taste off between two recipes and let people vote on which one would be featured in the upcoming meal. Here's another example of how you can make a chart with stickers or tally marks to collect votes. And you would be surprised at the power of a simple incentive like a sticker to get people of all ages to try a new food. Next up, Sites should use the materials and display the posters in a visible location. This is promotion. Um, as well as using other signage to highlight the foods and any promotional activities that you're doing. This is a great way to connect what's happening in the cafeteria meals to the educational or promotional activities that you're doing. Shown here are a few tips for promoting Harvest of the Month. Try to use multiple strategies for promoting the program. Reach out to the families and the visitors and patients, as well as your own staff. If staff aren't aware of it, they're not going to help promote it, and your work could likely go unnoticed. Also, the news media loves these stories, so reach out to a local news station or newspaper to cover a meal. Local is in, fresh is in, so this is a great way to highlight your efforts in serving fresh Montana-grown foods. As shown earlier, we did create some menu templates in Microsoft Word that have fun facts and a space for your site's information. This is a great great place to promote the producers that you're working with also. And we have this newsletter and social media content that you can edit and use in announcements and newsletters, social media posts, websites, bulletin boards, etc. And that's available on the portal as well, and I will show those. But that's meant to be a quick copy and paste. It's great to include some marketing staff on your team if you have somebody that does outreach, community outreach, and make sure that they know about this. Show them this webinar. It will be saved and logged online later. Bring other people into helping you with this. It's not meant to be done in a vacuum. Oh, here's the menu template. Here you can see how schools have promoted foods in the lunch lines. We've got a number of different materials that can be adapted to the different ways that hot meal lines are set up. And that includes dry erase, slicks that will stick on a sneeze guard, and those should all be mailed out to currently registered sites right now. Staff can help make creative signage and promote the program to others, like this sweet chalkboard sign made by a student down up in Hinsdale. Other examples from the healthcare pilot include some great graphic design work that was done by marketing staff at Kalispell Regional Healthcare. And they wanted to be able to use Harvest of the Month materials for their electronic menu boards, which are placed throughout their cafeteria and in some of the hallways. So we worked to make sure they had access to the files that they needed to be able to craft some of that. And be sure to recognize the farmers and vendors that you work with. It draws attention, it gets people excited. People want to know where their food's coming from these days. The fourth requirement of the program is to participate in evaluation. All of the participating sites have 3 required evaluation components. There's a beginning of the year survey that needs to be completed by the team lead before the program is implemented, preferably within 30 days of registering. This gives us a baseline of your program, and this only has to be completed once. So when you participate again the next year, you don't have to do this again. We collect baseline information once. Again, this is a totally free program, and the way that we're able to do that is through grant funding. And the trade-off is evaluation for free materials and technical assistance. Also, each month, the program sites submit a monthly report that'll take about 5 minutes or less. It's much simplified this year from what the pilot sites got to work with. So you can thank them for their dedication. And then there's an end of year survey that should be completed by the team lead by June 30th of each year. And that's also where sites re-register. The Harvest of the Month team gets regular status updates for reports and these requirements. That's part of that once a month email. So let's take a look at the materials and resources that you receive when you register. Each site gets a printed packet with the following posters and the handouts and Each of those includes fun facts and cooking information, recipes, activities, books, that kind of thing. And there's also one static cling that can be written on with dry erase markers. So we'll look at each one of those. The packet includes one of each of the posters. Right now, we don't have chickpea and dairy posters produced yet. The artwork has just been finished, and we're working on those materials. So you'll get those later in the year. Posters can also be purchased at the MSU Extension store if you want more posters at your sites, or if you're partnering with community businesses or organizations that want to feature Harvest of the Month items. And then the electronic files for both large and smaller 11 by 17 sizes are available to print independently for free as a registered site. Get a cafeteria handout. In addition to all the information that's on the handouts, the fun facts, the purchasing ideas, the storage ideas, the Cafeteria Bites handout includes food service recipes. And the executive chef at Kalispell Regional stated that the carrot puree for a lasagna sauce was a huge success, and many guests asked for the recipe to use at home for a sauce to accompany poultry and fish too. In response, we have produced recipe cards. Those are now available online. We haven't printed them out and mailed them out to anyone yet, but there are recipe cards available for printing. The Harvest at Home handout is perfect for sending home with staff or patients or their families, and it can easily be included on the website or on a bulletin board or at the point of sale. It's got the same recipes, just scaled down. And regarding the information that was provided throughout the Harvest of the Month handouts, some staff at Advanced Care Hospital in Billings said that it's been wonderful looking at how people's minds have changed. The excitement of staff, doctors, visitors, and family has been fantastic. So these materials do have an impact. They do generate conversation. Table tents are a great display material for cafeteria settings, and they're probably the chief conversation starter. A representative of Village Healthcare Center in Missoula shared the following quote: "We continue to place table tents on our dining room table and display the poster. This generates conversation and questions, as well as awareness that the facility is providing healthy food." And I remember Seth at Kalispell saying that there was a young man and his mother eating there, and they were remarking, looking at the lentils table tent, about how he had been eating these lentil dishes at school, and the mom was really impressed that the Harvest of the Month was making connections both in the healthcare field and at school. So it's great, to see that we can produce that overlap and have affect change through the entire family. So there are also digital materials. There's electronic versions of all the printed materials that I just discussed. There's additional table tents that you can print that are 11 by 17. You just have to cut them. And these are available all on the Harvest of the Month portal. It's the secret web page for registered Harvest of the Month sites. And registered sites have access to a slew of resources that are listed on this slide. And we just added the recipe cards that I mentioned. So let's take a look at the Harvest of the Month portal, so you know what it is and where to find it and how to navigate. Make sure you got my screen here. So this is the Montana Harvest of the Month portal website. When you go here, you will click on the healthcare link, of course. Any important announcements will show up here. I need to update that, evidently. And this is all one page, but you can jump down to resources through this menu on the right-hand side. Here you can select which month you are on, or which Harvest of the Month item you're planning on featuring, and get to more information and more resources for those items there. I will show you that shortly. Under Getting Started, there are Harvest of the Month 101 files. These are great for sharing with printing out and putting in a staff room so that clinical staff are aware of what the program is just on a high level. The 101 for cafeteria and food service is kind of a high level overview for additional food service staff. And there is also the calendar, which can be printed out, and we're working on a full poster sized calendar. This is just an 8.5 by 11. The Getting Started a monthly checklist is something that I recommend for everyone. Getting Started gives you, the first page gives you all of the steps necessary for beginning to implement this program and spreading the word amongst staff and the community that you're participating in this program. And then the second page of that is a monthly checklist, which is a good reminder each month of where to distribute each of these individual materials, that you need to be thinking ahead, planning on foods, giving reminders about promotion, and reminders about evaluation. And with promotion, you can always use Montana Harvest, hashtag MT Harvest of the Month. And I'll talk a little bit more about that later. Speaking of promotion, there's a participation letter. This is a Word document that's customizable to your institution and could make for a press release, or it could be a good addition to send out in a newsletter. There are menu templates under each month as well, but we put one here as an example. The Share Your Story link is a really quick web form for sharing a success, uploading a quick photo. We love to see stories. We are also always trying to develop content to put out on the web or to share with news media. So if you don't have time to do that, add a quick share the story, and that's something that I'm more than happy to help do, is promote your program. There are some guides here. The Farm to Cafeteria manual was just recently updated. This has sections in it that are for producers, that are for food service staff, and that are for community advocates. The food service staff section is probably the one that you would use, and it has basically everything that you need to know about procuring local food, whether it be ideas for independent distributors that you can purchase from, or how to work with an individual producer, what are the right questions. It takes building a little bit of flexibility amongst food service, because if you're used to ordering in a single weekly order from a broadline distributor like Sysco or Food Services of America, there's not much customizability. You can't get real specific here with them. Whereas if you're ordering from an individual producer, you get the opportunity to specify how big is a case? How should this be packaged? Do you want some kind of minimally processed food? And we offer a number of different webinars that are relating to that local food purchasing for institutions, if you'd like more information on that. But that Farm to Cafeteria manual offers a great guide with tips and checklists for working with local producers. Farm to Healthcare Resources will bring you to NCAT's Farm to Cafeteria page, where where you can get to some additional resources for that can be helpful in making the case to hospital administration that it's good to spend a little bit more on healthy food. This Find Local Producers and Food Businesses will also take you to the Farm to Cafeteria website that is farmtocafeteria.ncat.org. And I'll just take you there first so you can see. On the right-hand side are these two database links, and then you can also find the Farm to Cafeteria manual on that right-hand toolbar as well. So looking at the producer map, this is a map of growers that have expressed an interest in selling wholesale to Montana institutions. And within any given one of those, you can see what products they carry, there's contact information, and how they distribute their products. And this is part of my job, helping you guys locate the food that you're looking for. It's part of my job, so always feel free to reach out. Trainings, this is the section of the portal where this presentation will be logged, and then evaluation is where you should go to complete your beginning of year survey. There are paper versions of that survey available. Just email me. I'm not sure why the link is not up here. But if you want to complete a paper version, just please use this link to submit it online. And then I'll have this monthly reporting survey up in the next week, as those will come due for anyone that started implementation in August. So quickly, I'm going to dive into one of the monthly materials. Summer Squash has been this month. As you can see, there are downloadable copies of the large poster, an 11x17 poster. There's a link to the MSU extension store where you can purchase additional 18-inch by 24-inch posters. There's a link to the printable table tents, the cafeteria bites, the Harvest at Home. These three materials are all given to you in print, but you only get one copy of the Harvest at Home. So if it's something that you want to hand out to patient, staff, or visitors, please feel free to get on here and download the Harvest at Home and print as many copies as you need. This promotional content and social media posts is the example that was shown earlier in the slideshow, and has great copy and pastable language to make it really easy at the beginning of each month or before you do your Harvest of the Month meal to put a little blast out there with some fun facts or to promote your meal. There are sources for all the information that we've put on these materials as well. The menu template for Summer Squash gives some of the fun facts and spaces for your own information as well if you want to use that. There's a printable serving line sign, and you also have the static cling, that's dry erase. And then there are logos, and all of the illustrations are available as well. Below that, you can find the recipes. There's two printable recipes. There are 4 recipes for each month, for each harvest item. And these can be really fun to hand out to people if you're using our recipes. All right, I believe that is all that I want to show you on the portal website. So I'm going to dive back into the presentation. So that portal site, you can't navigate to it from anywhere else. It's not password protected, but again, as I said, we are only able to provide this stuff free of charge because we can collect evaluative information. So we really prefer that people who are using the materials on the portal are registered and participating in that way. So save it, bookmark it, share it with people on your team, share it with them, as many people as you want to in your institution. Just don't post it online, so that we can keep track of how many people are participating in Harvest of the Month. So how to register. If you are not registered, if you're watching this webinar and have not yet registered for Harvest of the Month, you can visit montana.edu/MT Harvest of the Month, and there is a registration link on that page. You can step from the registration link into the particular class of institution that suits you, which likely to be healthcare. And it's a simple registration form. From there, you'll be mailed all of those resources, as well as contacted via email for completing the first survey. So I'm going to spend a little bit more time talking about resources. There are thousands of resources out there to support this work. And our state team curates a wonderful list of both national and Montana specific resources that our experience with Farm to Cafeteria has shown to be helpful. And all these can be found on the website on this slide. That's the Montana Farm to School website. A lot of the Farm to Cafeteria work has been has fallen under this Farm to School umbrella. So if you see Farm to School, don't be run off. You're still in the right place. And I want to step through a few of the Montana specific resources that are available. I talked about the Farm to Cafeteria manual. It's a great procurement resource. If you're looking for the link to the Farm to Cafeteria manual on this montana.edu page, it's under the school food link. There are online trainings. There's some great procurement webinars that are under trainings and events on that webpage, as well as the farmtocafeteria.ncat.org page. And then the Farm to Cafeteria database, which I shared with you, is a great way to get in touch with producers that are in your area. If you've got questions about independent distributors, so that you're only placing an order with one new distributor as opposed to hunting down a vendor that can take care of each month individually, I'm happy to connect you with some folks that fill that niche very well. And then there are a few promotional events that are coming up. Montana Farm to School Month is in October. And it's a great opportunity to, if there are Harvest of the Month schools in your area, likely they're going to be doing lots of events for Farm to School Month. It could be a great way to kick off and partner to begin Harvest of the Month at your healthcare institution. Also, Montana Crunch Time, I will talk about that momentarily. And importantly, I'm a resource as well. If you got a question, if you can't find an answer with a search online or on that Harvest of the Month portal, always feel free to reach out. I'm happy to steer you in the right direction. And there's a few exciting opportunities that are coming up. One big opportunity, if you're interested in local food for schools, the Montana Farm to School Summit is going to be held September 13th and 14th in Missoula, and it will, again, it's a biannual conference. It'll be fantastically chock full of field trips and workshops and speakers from around Montana and the country, and of course, delicious food. Registration is still open until the 6th of September, I believe. And then Montana Crunch Time. So please join me in celebrating National and Montana Farm to School Month this October, as well as Montana Crunch Time. So we encourage all Montanans, wherever you are, whatever you're doing, to participate in Crunch Time. It's October 24th, which is National Food Day, at 2 p.m. And we all crunch into locally grown apples at the same time. We've had upwards of 30,000 people while biting into apples. I've always called it the crunch herd around the state. And this year, we're actually competing against Idaho and Wyoming because they do this event as well. So log on to that Farm to School website and register your crunch so that we can keep track of how many people are doing this in the spirit of friendly competition, and share your crunch bites on social media with the hashtag MTCrunchTime. It's kind of fun if you're into social media to go back and look at crunch bites from this past year, or you can send it via email if social media is not your forte. Also, remember, share your Harvest of the Month story. You can share photos, lessons, stories, and recipes using the Share Your Story form on the Montana Farm to School and Montana Harvest of the Month websites, or you can email me anytime. use social media to get the word out. We don't have a Montana Harvest of the Month Facebook page. We use the Montana Farm to School Facebook page for most of that. And a lot of social media posts that go out are utilizing the hashtag MT Harvest of the Month. We also, under that share your story link, there are USDA photo releases, particularly if you've got children in any of your pictures. This allows us to be able to share and use those photos. And don't forget about your local news media. Shown here on the right, Fallon County Extra publishes an article every month from Plevna School out in eastern Montana about Harvest of the Month. So thank you so much for your time today. I'm grateful to have your help in expanding the Harvest of the Month fun